All right, well, thank you for joining us. My name is Ben Tabbal again, the associate pastor at the church, and I'm here with Dr. David Park, and then also with Dr. Hugh Chung. And so we're just taking some questions and answers after our service. And I just want to stipulate in the fact that, these are church members, and we are recording this with the hope, the fact that this would help our church people. For those who have joined in on our conversations. And I also want to just say, just the fact that, as we record this, they are not representing their organizations per se, but at the same time, they're coming in as basically their expertise and some of the things that they have been doing and everything. Okay? So hopefully as we start this. And so I just want to take a very brief moment just for each person just to introduce themselves and as we were talking about why you are valid to talk about this. Okay? Go ahead.
Okay, so for those who don't know me, I'm David Park. I'm a medical oncologist, a hematologist at St. Jude Medical Center in Fullerton. So you may wonder why would an oncologist talk about COVID? And so first of all, yes, I'm not representing the hospital or my group. I'm here as an individual. But during the early days of the pandemic, which seems ages ago, but it was really maybe like 7-8 months, literally, that hit us in the U.S. We were all scrambling and trying to figure out what to do. And the first thing that we had to do is try to do some research, do some trials, test new drugs, new approaches. And so I was asked to lead those at my hospital. So that's really where, and I've been doing that since then. So I'll be here trying to answer some questions and along with you as much as we can.
Okay, well, how about you, Dr. Hugh?
My name is Hugh Chung, and the core of my specialty is surgery and trauma, but official title is actually surgical critical care. We are trained in intensive care, and that's how I got involved with COVID. I got directly involved when Los Angeles launched their surge hospital. I was actually with the planning committee, both in terms of logistics as well as how to manage these patients on a critical care level. I am very well versed in ventilators, the multiple organ system management, and as an intensive care physician, that's what I do. And so I was able to focus my efforts on COVID, and I was invited to help not only again with planning, but with actual implementation of the management. I have a background in public health as well, and I think that helped also with that regard, how to encompass it and approach it from a population aspect as well.
Okay, great. Well, thank you guys for just taking time to do this, and I know it can be nerve-wracking sometimes. So hopefully these questions will be easy enough to answer. And so some of these many of the things that we already know might be or have been on media already and everything else. So, but at the same time, I just wanted to ask these questions that were asked. So, how much do we know about the virus itself? What do we know and how it spreads, and how do we know the fact that who's most at risk of getting it and who's the least of getting it, basically? So the way the 7th grader asks is, how does this virus spread and how do we get it?
Okay, so I think that the information is there. We know a lot. It's been 7 to 8, maybe 12 months. If you think of, depending on who you talk to, that this virus has been around. So we know a lot about this virus, including the genome, the genetic code. We know how it also can change over time. We also know how it spreads. For the most part, it spreads through people to people, right? Droplets being that most common way of spreading, and that this is where masks come into play, right? The masks that we wear, at least the ones that the public wears, stops a lot of those droplets from either mostly from going from you to someone else, and sometimes also from someone else coming to you. So, and then there's these other lesser sort of important ways that it spreads via what they call aerosol, which are these very, very fine droplets that can stay in the air for some time. But that's really a minimal part of the spread, mostly the larger droplets. And again, in the beginning of the pandemic, we're also worried about surface areas, right? You touching things and touching that and touching your face, et cetera. And then there's probably a role for that too, but again, that would be not as much as we feared in the past. So, I mean, doesn't mean that we shouldn't be careful, but I know people in the past were washing groceries, things like that. And so probably, it's not wrong to do it, but that fear has lessened over time as we found more about the virus.
Yeah, just to expound upon that again, some people are wondering what's the difference airborne and aerosolized, right? And so the airborne is usually, and again, you can correct me if I'm wrong, when the entity itself has managed to travel in the air, without any assistance of a vesicle or our droplets somehow manifest to be able to travel airborne, and that's not quite it. It needs, again, a droplet, and again, the larger the droplet, the better it spreads, the fine mist. And that's why we've run into the controversies about masks, because, is a mask so protective that it can stop the virus from poking through the little pores? No, but again, the aerosol and the air and the droplets, there's a diffusion coefficient that's affected by that, and that's what's clearly blunted. And again, that's how it's mainly transmitted. In the operating room, we worry about other bodily fluids, and whether it's again from within, even the GI tract stuff. Again, there is evidence out there that those modes of transmission are possible, but again, the main, as Dr. Park was mentioning, is really through the respiratory system and the droplets.
Yeah, so talking about one of the questions that they had was basically if someone is asymptomatic, positive, wearing a mask, can you still get infected by talking to them?
Right, so it's never a zero, all or none, right, phenomena. There's a lot of things that go into play. But by and large, asymptomatic spread is a problem, right? That's really the way that this virus has essentially been spreading through most of the world, right? So that, and this is why we are encouraging and really encouraging everyone to wear a mask, to almost, I'm not saying to be paranoid, but to behave as if you may have the virus and you're not symptomatic from it. So there is a risk that I would spread it to someone else even without me knowing. Now, me wearing a mask will definitely decrease the risk of me, David Park, spreading the virus to, say, Ben, right? And hopefully you are wearing a mask also, and we keep social distance like this. That will be helpful as well. It's not 100% though. So it's not like it completely abrogates the transmission of COVID, but statistically it will decrease it by significantly by wearing a mask.
Okay.
Yeah, and there's many studies done about this, very sophisticated studies looking at droplets and airborne and looking at different types of masks. So I just don't think that there is really a controversy here. There should not be.
Yeah, so people should be wearing their mask, and still yet it's not 100%. It's never a zero chance of not getting it. But at the same time, it does stop the spread. Okay, well, it's really good to know. So I think this is more for some of our families. Some people think that kids get it less and it's more milder. Is that the case? And what is the latest information that we have about that? Want to take time?
I can. So it's definitely has been known kids get it, but again, the degree, severity, all that is still not quite even known. Let alone it seems to be not as severe. But even though 8 months seems like a long time to us, in the realm of medicine, especially with something new, 8 months is a short amount of time. And even though we've managed to learn a lot, there's still so much we still need to know. And I think that's where the controversy lies, because kids, and again, maybe Dr. Park can expound more, but again, I haven't had to treat kids because, they haven't had to be severe, they haven't has been as severe or as frequent. But going back to then asymptomatic, there's certainly no biologic factor that's showing that they're protected, meaning that they can't get it and can't carry it. And that's what is very clear is there's an asymptomatic portion. That's where kids are the problem, where they can easily carry it.
And then so along with that, so it's like there was a question that talked about age. So what age group do you see or attend to the most?
What I see most are adults, middle-aged and older. When I say middle-aged, not to offend anyone in the room then, but usually late 40s and older, because they're the ones, for whatever reason, have severe symptoms. But again, my practice now isn't so much on the forefront of COVID. I am back in my surgery world and trauma world, and I am seeing 19-year-olds, 25-year-olds with it being positive. Most of the time, I'll admit, they are not as severe in their symptoms, but they are. I do see them as their recovery is protracted because now they are symptomatic from it, or just for whatever reason they're not getting better from their injury, and is COVID potentially a contributing factor. Again, so for the most part, late 40s and up are the ones where I've seen them actually really severe.
Right. So that's the is an important distinction that we need to make a difference. So we are seeing generally patients who are hospitalized, right? So these are patients who are sick with their COVID-19. And they tend to be the older patient. They tend to have some other issues like obesity, diabetes, etc. So those are the ones that get hospitalized. So this is a very difficult virus to track from the public health standpoint because for a variety of reasons, and we can go on and on and on about the challenges that we've had since the beginning, including the availability of tests. Whether tests are resulted on time. So we may have a large group of people that are asymptomatic, especially young, who are not being, we don't know whether, how many young people are affected by COVID, how many are positive. So we do hear about them, 17-year-olds, 15-year-olds, who just tested positive, but they're at home and they're doing fine, right? A lot of them. So it does affect, or at least it infects essentially everyone that comes exposed to it. That is a very high infectivity rate. So a lot of people can get infected, but does not. We just don't know because many people are just asymptomatic. So there are big population studies that are being done where we're just testing big groups of people to try to figure this out too. Those tests themselves, those studies, also have their limitations because many of them rely on antibodies, and depending on when you test them, sometimes they have not produced the antibody. Sometimes, depending on the sensitivity of the antibody test, maybe a few months later, you just don't see it in their blood, even though they were exposed. Doesn't mean that they're not immune. You just don't see them. So there's some things about COVID that we're still learning. Okay. We're still learning, and there's going to be more and more things that will, in retrospect, we'll have a lot of just kind of aha, that's what happened and that's what happened.
So you mentioned youth and everything. How about kids, the younger kids? And here at our church, we have a lot of these younger elementary, even preschool kids. Have you seen any of those kids test positive? I don't know if you've had any cases of those.
So we're an adult, mainly an adult hospital. So we're not pediatricians. I'm not a pediatrician.
And I haven't seen any either. Again, we're limited in who we treat. Again, it's an unfair sample, I guess, because I'm only treating who comes into my hospital. So I guess we wouldn't be the best people to ask in terms of how severe kids. But again, we've been exposed to data enough where it still seems to be a minority of the issue. I might be digressing on us a little bit here, but then some people will give out the question, why not just lock up the old people? Why not just lock up these susceptible? Let the young people and live their lives. Open Disneyland to the 20 years old and younger, right? I can get a common color commentary and say that's a little bit of a selfish approach, but because again we still don't know how it still circulates among these. Are we still just propagating it even though you're asymptomatic? You're still allowing this virus to flourish in a way, and I don't think that's
and I don't
the right
know
approach.
if anybody would want us. I don't want to get it. They didn't get it. There's not many people I know who has been exposed to it. You've been exposed to more people, but the thing that I've been hearing, and it's always that concern, like if you do get it, having long-term complications. And I was just wondering, it's the fact of with the severe cases, but are there long-term complications even for those who have milder cases of it? So anything you've heard of or anything?
Yeah, so there's more and more data emerging about that. But I do want to point out that there is reports and research about younger kids getting it in youth camps and daycare centers, and by and large, I think it's very well accepted that the younger you are, the less chance of you getting actually sick from this. That most young kids actually do fine. The vast majority, actually. As far as post-COVID, they call it either the post-COVID syndrome or long hauler syndrome. That is emerging data on that, and we don't really know exactly the mechanism of why this happens. It could be one thing that happens with COVID is that your body reacts a certain way. So it's not just the virus, but also how the host reacts to the virus. And in order to fight the virus, but then it creates what we call a hypercoagulable state. So there's more blood clots happening with COVID, strokes. It could be even microthrombi or small clots that you can't even measure by doing a scan or an ultrasound. And that may cause some long-term effects, mostly temporary though. They don't really, unless you're really, really sick, they don't seem to last a long time, but sometimes they can last months. So I know people that had COVID and sometimes mild symptoms, they were convalescing at home. They'll tell me something like, hey, Dr. Park, I'm usually like really sharp and I'm on my feet thinking and full of energy, but it's been 3-4 months and I'm just sluggish, right? So there's actually now rehab programs that are being set up for these patients to try to figure out how to help them maximize their recovery. So yeah.
I mean, I'll go from both the direct COVID standpoint as well as just general physiology. Well, first from the general physiology, when people are in the ICU and they're that severely ill, just recovering from that, from anything, you are debilitated to some degree. So a post-ICU syndrome, post-recovery does certainly exist. And then when you transpose that to COVID infections, we know how deteriorating the lungs get. There have been other illnesses in the past where like H1N1 was a big deal for actually the very robust immune people. So just go off the immune system the way with COVID it goes a little haywire. It's unbalanced attack, and that's what really caused a lot of damage. And then with people who have strong immune systems, actually, and this is with H1N1, that's why they were really, really sick, because their immune system was so strong it attacked the body. And so when I see the COVID people get it, it's not only just because of the severity of the imbalance, but then say like it is a young person getting it and they get severe, that consequence of that immune response does damage to the tissue in the long term. The technical definition is a respiratory failure, but then you have an advanced version called acute respiratory distress syndrome, ARDS, And that is just a general term for how bad your lungs are. And recovering from that, there is long-term effects. Your tissue is just scarred up from the whole getting beat down from it. So if you were a professional athlete and trying to come back from it, you might, I wouldn't doubt it. I don't know the data because we just haven't tested it, but I'm sure you have a limitation of what you used to be.
Yeah. So with all of that, can you get it twice?
Well, there are documented incidences out there, right? And I don't think that's the main modality of how people are getting infected. And maybe Dr. Park will know more about the reinfection rates, but yes, and medicine will always kind of mess with you. Even if you don't think it is transmitted one way, someone out there will have found a way that it does, right? And so, yes, you can, short answer, but it's not going to be a big majority of the cases.
Okay. And so just thinking about this and the fact that, like, right now people are getting tested and everything, when should they go and get tested? What are the, those things that people should kind of be looking for? Like, should I just stay at home and I still don't feel well, should stay at home? Or at one point, should I go and start seeing the doctor, get tested to make sure? So what do you say for that?
So that is it's a frustrating question, to be honest, because the answer should is a little bit of a it's really frustrating because it has to do with the availability of tests. And I know that this sounds crazy, and there's a lot of tests that are being done, millions and millions of tests are out there, but we're still not, it's still not as widely available as we would like it to be. So, and this is the problem. I think from the epidemiologic standpoint, anybody should be able to be tested anytime. That should be the best way, right? It should be so easy. Point of care testing, you just go and just get tested and you get the answer within 30 minutes, an hour. The technology is there, but the availability of kits, of machines, reagents, etc., that is really has been one of the biggest frustrations, at least probably everywhere, including the United States, where we're just still struggling with getting testing done. So the short answer is, if I were to be king and rule the world, which I don't, I want instantaneous tests for everyone, anytime. But that's not happening, and that would help a lot.
Yeah, so because we don't have the testing readily available to us, so if I feel like, I'm not getting tested yet, but if I'm at home, what can I do to take care of myself? Is it just the normal Tylenol, cold medicines or something? Or is there something more should I be doing?
Oh, okay. I'll go off with Dr. Park for a little bit here in terms of, yeah, I agree. Then we can start to tangent into the political realm of the whole testing and stuff, but it should be readily available. That's the shortest answer I can give. Why? That's the thing. Maybe that's why people have argued over it so much, but again, it should be readily available, and that could also then be the reason why we can get better guidelines of how to manage it. Because your question is very valid. What do I do when I'm not so severe? I mean, because the treatment is still just you just wait it out and hope you get through it, right? That's the shortest and simplest answer. Is we don't have a silver bullet thing that will just cure you. There are medicines out there that are always being investigated, but if you're mild, you stay home, take some of the medicines that can help ease the pain. Now early on there was issues where maybe like Advil and such would actually make things worse, but for the most part, again, usually the people who are mild enough can take these medications at home to make them feel comfortable. And so therefore what you should do is just one, you don't want to spread it to others, so you stay home. Two, you don't want to get worse, so you get some rest. And three, do what it takes to make you feel comfortable while you're getting some rest. If that means putting on an extra subscription of Netflix or something to help you get through it, that's fine. But because the flip side is, if you don't make yourself sectioned off is you might still get through it just fine, but then you're passing it on. And then going back to the testing, well, I need to get tested in order to know whether I should treat myself that way. Well, again, whether you feel crummy or not, you're still going to want to stay home. So you don't need to expose others in the meantime, right? So if you're asymptomatic, and you're worried, I have a personal reservation about just getting tested willy-nilly, but that's just because, as Dr. Park mentioned, we don't have a robust system where you can get it tested. So you're going to the ER randomly, or you're going to an urgent care randomly, and those facilities have tests, but they're not equipped to handle, well, what if you're positive? Oh, great, now we're going backwards. Who was exposed to that person, right? If we have a testing system, we can methodically track you and as well as protect you and protect others giving it, because that doesn't exist right now. So.
Okay. This is a kind of a longer question, so I have to read it and see if it makes sense for me. I personally have a lack of faith and trust with the mainstream media, and somehow these politicians are not qualified or competent to speak in the matters of this pandemic, as I have seen and heard of the discrepancies and manipulation of data. However, as a believer, I do feel that there is a sense of being able to understand the risk of the pandemic from a healthcare professional that you trust is qualified and is someone that you have developed a relationship with. Would this be a viable option in terms of being informed, and do you have recommendations of other alternatives to be informed despite our current climate of our nation and world? So basically, where's the best place to find information as I read this?
So, that's a tough question to answer to the satisfaction of the person who's asking. What I mean by this is that I think most of us have enough information right now that is useful and that we can what I call actionable information. So we may not know everything. We may have some misgivings about a politician or a governor from one state saying something versus from another state saying something else. But I think most of us have enough information about this virus, how it spreads, what it does to people, to make fairly informed decisions for yourself and your family. So I would just stick to the basics of that. Whether the numbers of COVID deaths are exactly what they are, whether it's overblown or, as in one criticism is that you may have COVID because you tested positive, but you die of something else, maybe not related, but it's counted as COVID death. I'm just gonna say that's something that comes out, right? Yes. But at the end of the day, for me to make my decision on how I should behave, what I should do for my family, I don't know if that's super relevant. That's a higher level discussion about what should happen policy-wise and so forth. And it can be frustrating. I understand the frustration of people who really want correct information. But I think the information that is out there is good enough for us to make informed decisions, actionable information.
Yeah, and we'll get to those at the end of that, of just some of the things. The big question, I think, for many of us is because of the announcement of the Pfizer vaccine, possibly 90% effective, I watched the news and all of a sudden Russia comes out and says our vaccine is 92% more effective. But what is the likelihood in terms of effectiveness and distribution actually is a big thing too. So if anybody I know you might not be totally intimately involved in it, but as doctors, what do you think?
Well, Dr. Park could probably talk more about the actual maybe biology and physiology a little bit, but I can tell you from a statistician standpoint, right? 90% is still, it's an early number, and traditionally vaccines are deemed great if you're over 50%. So this number could easily go down as you go to phase 4 trials. And the phase 3 isn't even finished yet. So they're kind of in the middle. So 90% also is very, very misleading in the terms of it's ambiguous because it's not necessarily delineating who is it most effective. Is it effective in people who already have a robust system? What about the susceptible population? But even more so, is it going to stop spread? We don't know that. So just because you can get a vaccine that helps you not maybe get effects from the virus, are you still carrying it and replicating? We don't really know if it's still eradicating within you. And then is your vaccine, because we think of vaccine as immunity, is your immunity even, long-lasting? And again, this particular one from Pfizer, it's a dual dose. You get one, and then 3 weeks later you get another. The long-term implications and logistics of deploying that from a population standpoint, how do you get? It's hard to get a person to the doctor once, let alone come back in 3 weeks. And as soon as you deviate from that, all of a sudden, whatever data was used to apply that is, so it's hard to say.
How about you?
Yeah, so the way I would look at this, and this whole thing about new therapeutics, and there's definitely a lot of, it's unprecedented. I know people like to use the word unprecedented a lot about COVID, which it is, because it is unprecedented. There's many things that are unprecedented about this, is the amount of money and just manpower being invested in trying to turn this off. And because it's just really causing a lot of problems everywhere, right, at multiple levels through the world. So I would look at this as a big win in some ways, right? Definitely. But there's not going to be one silver bullet, one size fits all answer for COVID. There's going to be, it's not either or, it's a both and. There's going to be vaccines at different levels of efficacy, different kinds of vaccines. So the Pfizer vaccine, the Moderna vaccine, they work a certain way. Other vaccines like AstraZeneca works a little bit of a different way. So there's going to be different vaccines. There's going to be better therapeutics, better understanding of when to use a certain therapeutic in the course of the disease. Even that is a little bit tricky with COVID, where some things work better if you give it early, some things work better if you give it a little late. So there's all of that. So it's not going to be a one answer, a simple answer. I know we like that simple answer, but it's going to be a little bit more nuanced, a little bit more complex.
And you're saying like there's some things maybe possibly coming around the corner pretty quickly, maybe?
I think that within the next 3 months, and I know that's not soon enough for a lot of us, we're really tired. All of us are tired. I think that we will see more better therapeutics coming down, and I think that we're going the right direction. It's just taking time. But then, if you think about it, we have never experienced something like this before, besides 100 years ago, right? So this is a big challenge, but I think a lot of people are really working on this. A lot of people are really just investing. Everyone, pharma companies, the government, they're really making this a top priority.
Yeah, and it's great in the fact that we do have so much resources going to it, and it is unprecedented in a sense where, when things like the AIDS pandemic, for a long time, there was so much unknown about it. I keep saying the fact that for a long time, people thought you could get it by sitting on a toilet seat, and there was all this hysteria of all that. And as we learned more and more about it, there was a way of kind of learning how to kind of treat it and handle it a little bit better and everything. So it's good.
Right. I wanted to go back to a little bit what Dr. Park was saying. It's just, what should your response be? We do have, even though we still have a lot to learn about, we do have enough to make reasonable human decisions, because even when these treatments come out and things are around the corner, it doesn't mean all of a sudden the lockdowns or the social distancing should stop. Like, this cancels out those efforts. These are all tools in the bigger scheme of battling. I use kind of an example of like say like you're a boxer and you're sparring, right? You're doing nothing is when you're blocking the punches with your face. No one wants to do that, right? And then the vaccines and the therapeutics are when you have your guard up. You're still getting hit by the virus, but now you have something. And your first and foremost thing is you want to dodge these punches, right? I mean, and so these efforts to mask and stuff are still going to be in play even when these therapeutics come out, because that's how we truly get things done. And so this is really a message to anyone out there. You still got to hunker down. Again, not because again we're losing or you have to worry about it, but it's your part is really important. And because
so in the midst of all of this, I guess the big question is how do we stay safe during these times? That's the one question that people basically are asking, because we hear different statistics and everything. I actually was hearing from the mayor, the LA mayor, saying that somehow even sometimes the lockdowns don't really have that much of an effect. He was saying that. I didn't know what that meant by that. So what is it that we should be doing, especially we're entering into the holiday seasons? How do we stay safe? And people might already know this, but I think it'd be great to have a good guideline of what to do.
So what I've taken just from my own personal perspective is just think of yourself as the danger, actually, because that's probably maybe an easier way to, because we've been so much trying to put the barrier. Now think of you as the danger, because I'm exposed actually quite a lot, and my wife actually jokes that maybe I should have my serum studied because But the whole point is, Dr. Park mentioned we have enough information to know what to do to stay safe, but what can you do to keep others safe? So be mindful of who you're in contact with. Holidays are important, so I'm not saying don't ever see anyone, because it's a hard thing to profess and really swallow. But if you don't know who you've been around, and let alone you don't know who they've been around, that should be enough of a sensible red flag to maybe put some caution barriers. And that's kind of how I look at it, is just me being the danger. And if I think I'm putting others at risk, that's the litmus test I use.
Yeah, and these are not simple, easy answers, right? So people have to, and they have. I mean, people have made tremendous amounts of sacrifice in so many levels, right? Some parents, they had to quit their job so that their kids get supervised doing Zoom education, right? Some people are going to work even though they don't want to go to work because they're afraid. Some people, they can't go to work because they lost their job. So it is hard. It is hard to ask more from people. There's no simple answer. If you think about it, it's not like, how many people should I be hanging out with? What is a safe number? There's no quote unquote 100% safe number, but there's a lot of things that we do also in life where probably if you think about it, it's not 100% safe, right? Driving, things like that. So we just have to use our common sense, but also understand and be considerate. In some ways, and this is what I tell my family too, and myself is, and again, not be paranoid about it, but think of you as possibly being an asymptomatic carrier, as a possibly, so that you just do as much as you can, wash your hands, put on a mask when you're dealing with other people, especially indoors, and just use common sense. I think common sense, if you go to a restaurant, if it's very crowded, I personally like eating outdoors. That's my personal thing that I do because of also the type of patients that I deal with. So so that's just things that we do. There's no one hard and fast rule, I think, and we also have to have a little bit of give a little grace to people. If you see someone kind of not obeying or going through the social distancing that you think they should, I don't know if it's like jumping to some judgment is the right thing to do, right? So everyone's really trying their best. So give a little grace to each other, but think of you as a possible carrier and just act like it.
That's great. Well, thank you guys both for just taking time. Do you want to say a last second, 10, 15 seconds?
Oh, well, I mean, again, just it's hard to keep your spirits up through all this, right? And in the big scheme of things, it's just really trying to think of others. That's the way I always try to, we all kind of, I think inherently as humans, don't want to intentionally hurt others. And that's kind of the best way, I think, the take-home message is this. We're doing our best not to cause harm to others, and both obviously physically, but just psychologically. We just got to keep boosting each other. We've been so unforgiving, and the public as well as the medical community. Because even some medical experts are divided at times, like how bad, and as soon as some information changes or something, oh man, you must be wrong. So you've done worse. Going back to one of the questions, how do I trust the media and so forth, right? It's so hard when we don't forgive the aspect of human error. And we're built to be wrong. We're not exclusively all-knowing, and we have to be allowed to make changes, because we're not making changes, I think, to be more burdensome. If we feel that way, and yes, it gets politicized, but all intents and purposes, if we just kind of hunker down and support each other, I think that's the best way.
Yeah, that's a great word. I mean, we're in the midst of a pandemic where we're still learning a lot about the virus, where there's a lot that we know, but there's a lot more that we still yet need to know. There's going to be some guidelines that would be made. It most likely will be changed over time. And it might end up being more stricter. It might be a little bit more loose on some of the guidelines. We just don't know. But the things that we do know, at least we should go and maybe take that to mind and treat ourselves as if we are the ones who are the infector, in a sense. So, but thank you for your time and everything. Thank you guys for just joining us, and we will see you next week. And many blessings on your day. Okay, see ya.